one has a higher chance of getting the
preeclampsia.
Okay.
Or the
What are some of these?
So usually we tend to look at it in this way. For the maternal, we say if the person is less than 18 years, if the pregnant woman is less than 18 years, she has a higher chance of developing preeclampsia.
Wow.
Hypertension in pregnancy.
Okay, less than 18 years and become pregnant.
Some say less than 20 years.
Okay.
And also if the maternal age is more than 35 years. 35 years. Some say more than 40 years. So if you fall within this category, more than 35 or less than 18, you are at risk of developing preeclampsia, the hypertension.
So you're essentially telling us that you shouldn't get pregnant.
No, I'm not saying that. But of course, it's very important.
Okay.
I mean, less than 18 we expect you to be in school and stuff like that.
Wow,
so
I see. What other risk factors?
Then if this is a new partner.
Okay.
If it's a new partner, there's a higher chance of you developing. Yes.
How possible?
Like I was saying, you see, this is the first time maybe you are conceiving. So the theory says the maternal tissue.
Let me understand that well. If you have a partner you give you've given birth to,
some marry maybe
one or two.
They marry now and then
they marry again.
Divorce and then marry a new person.
Okay.
Like especially.
So if you marry probably second, third one, likely.
It's a chance.
It's a chance.
Yeah,
I see.
It's just a risk. It doesn't mean all of them.
This one,
it is very true.
Most of the people that you see.
Yes.
Okay.
It's either the last two cases we had.
Okay.
Yeah, the girl was 17.
Wow.
Yes.
Wow.
The aggressive.
The aggressive.
She was 17 years
wow.
old.
It falls in line.
Yes, and then if you are a black person,
black people.
Yes.
What is wrong with our melanin?
I don't know.
I
then
see.
Of course, if you are obese too.
When you say obese, like
if the person, when we check what we call body mass index.
Okay.
Your
weight and your height.
Your weight and height is when your weight we divide by the height squared, and then it is fall within a particular range. We'll say,
you're obese.
You're obese. You're at risk of developing. Then if you had preeclampsia in your previous pregnancy, you are at a higher risk of developing it again.
Okay.
Then of course, if the person already has hypertension,
the
person is at risk of developing preeclampsia.
Okay.
Then the other reason is if the person has other medical condition like diabetes.
Okay.
Yes. Okay. And if you have a family history of preeclampsia, already puts you at risk.
Oh.
Then also with the fetal part, if you are carrying more than 2 babies.
Okay. Like triplets.
More than one.
Okay. Twins.
Twins. Triplets.
Okay.
Your risk also increases.
Wow.
And if the baby has some abnormal condition we call hydrops fetalis. I don't know how I explain that one.
Hydrops fetalis. We'll write it down.
Yes. You are also at risk of developing it. And of course, if you have some genetic condition, you are at risk of developing the preeclampsia. Oh. Yes. So these are some of the the list is not exhaustive, but these are some of the risk factors.
Wow. Listeners, we are being educated here a lot. By Dr. Prosper Abuchi. You are listening to the program Health is Wealth, dedicated to helping you maintain and have a good health. So, Doc, what are some of the symptoms of this hypertension in pregnancy?
So, if we keep saying, if based on the category you're appearing, usually the person may be asymptomatic. If it's just chronic hypertension and the person is already taking medication, it may not really show any sign. Unless the cause of the hypertension maybe is secondary. Okay. If you have a renal problem, which caused your hypertension, of course, the signs and symptoms of renal problem will manifest. Sure. But let's limit it to preeclampsia.
Okay.
So usually for the preeclampsia, the person sometimes may be gaining weight excessively.
Excessive weight gain?
Yes, rapid weight gain.
Okay.
It is rapid weight gain. Or the person may have edema.
What is edema?
Like swelling.
Swellings, okay.
Usually, pregnant women tend to have swelling of their legs, their leg and feet. later in pregnancy,
Okay.
getting to
And
the end,
that is a bit
that is
normal. Okay.
But if you are beginning to develop the swelling around your hands and then your forearms and then your face, which we call the non-dependent areas,
Okay.
then
It's a cause for worry.
yes, it's a cause for worry, and we say this person is likely to develop a preeclampsia. And yes, so the edema is one part. Then sometimes if complications are setting, like we were saying, the person will be complaining of a frontal headache.
Okay.
It's like migraine, frontal headache, and it is throbbing and very painful. Yes, frontal, which will not resolve in it. It's just sudden onset. And sometimes they will complain of blurring of their vision.
Wow.
Yes, it is that bad. Then in some cases, they'll be complaining of severe pain around the upper portion of the abdomen.
Okay.
The reason why they have that pain is because sometimes the liver tends to be affected by the complications of the hypertension. So if the covering of the liver begins to expand like that, the stretching gives them the pain, and it is, you will not take any
painkillers to relieve it.
No, it's not that easy. Yes. Yes. So these are few of the. Then in some cases, if other complications have set in, like I was saying, that the lady with a HELP syndrome.
Okay.
It means the person will be passing very dark urine.
Dark urine?
Yes, because the person is breaking down the red blood cells at a faster rate.
Okay.
And then the person bleed easily because the disease condition causes consumption of the
proteins.
Yeah, the platelets.
Okay.
So the person bleeds easily.
Wow.
You understand? So that is in the extreme cases. It's a very dangerous Then to the baby too, sometimes if the symptoms worsen, the person may come with bleeding because the BP had gone too high up. So the placenta will just separate.
Wow.
Yes. That's what we call placenta abruptio. Because the BP
will just separate in the...
yes.
Wow.
Yes, and the person will just be bleeding like
And what will happen to the baby?
If there is no blood supply to the baby, chances that the baby will die. Yes. So this is what could happen in the long-term effect of BP if it's not controlled.
This is serious.
Yeah. So the early sign, early warning signs with preeclampsia is what we've mentioned earlier. The headache.
So please hammer on those ones for us so that we'll be able to identify
the rapid weight gain.
Rapid weight gain.
Yeah, that's why when the pregnant women come to
we always check their weight.
We always check their weight to see whether the weight gain is rapid or not.
Okay.
Yes. Okay. The rapid weight gain, the elevation in blood pressure, which when we check we will know, and then the proteinuria when we use the dipsticks to check your urine.
So that's why anytime the pregnant women come, you tell them to.
It is very essential.
Yeah, urine.
Yes.
Wow.
Then of course the signs and symptoms of imminent severe preeclampsia or eclampsia, the headache, the blurring of vision, or the severe chest pain, the epigastric pain. And in the worst of scenario, you see them having the edema, the non-dependent one, the face, the arm, and then the abdomen.
I see.
Yes. Wow. Then, if complication has already set in, then you see the other complications manifesting.
This is getting interesting. So, listeners,
then your risk is times 2. Chances that alone a close relative, chances were attention it's also there. Then na BP low long having a full near lemon and a full Benovio lower top coin a hand or BP attention you for attention of so a disease condition some genetic disorders solely. Na ye adela de bien wa ha attention of funo in a BP. In better like preeclampsia near blood level manifest now. Of course, now my van, let me check your BP are not before. Me check your order drum your power protein lemon. I draw your full focus and no weight gain cover. more than necessary. But I mean, say, I'm going to wait from that. Wait, have I him subu apa? Alona ma vata tem. Food no na ofo for together over 4. La atena. Na afu chichim in alaba afu another avuka the kajita de we labo try the Germanian catain ana a cheer donavi the na amaba ashi plafo doji aloyo mu but ashibido tatama ha kama mala okay okay chances by mama upon preeclampsia is also high amaro global nova you but tayo do at tango ha alo ubang kujikata o kusu muna nakapomo alo how do I say you jitam pa akota ever some na mo ubloka mo talk we no kaka na ko me it's likely but BP if food dominate that la be me akọ egbo
Eblo ayo eblingade ebe rapid weight gain afoncho ayaham laka ola na gona
me akwena evagba o check o weight o ngloka dari na eva next time o check the limitly but attention akọ akana agbon manya maka ko mi bablo me yo papa me jifo akọ akana mi papa instead of maybe 11 akọ maybe 1 kilo every week about 3 4 little alo mi papa batatama that is a form of rapid weight gain alaba mi alan kudan.
Very well. So, our listener, it sounds very depressing. That it looks like there's no way out. Is there any way out for someone with this condition? What do you do? What is the help? Any way of treating it, preventing it, all those things?
Okay. So the key thing is being able to pick it up early and then helping to manage the person appropriately. Yes, there's treatment. That is if you are able to detect it early. But the only solution is if the pregnancy is over. Yeah. But the key thing is to detect the hypertension early, putting measures in place so that the person's condition doesn't worsen. This is what is very key with hypertension in pregnancy. You want a good outcome for mother and then for that of the baby. So with regards to prevention, of course, people have tried so many remedies.
Okay.
You know, they've said when we supplement the people's nutrients with vitamin C and vitamin E, it's supposed to help. But research has shown that it doesn't really help.
Okay.
And of course, we've also talked about calcium supplementation and then giving of aspirin, soluble aspirin at a low dose to help prevent the preeclampsia. But of course, if the person is coming from an area that has high calcium in their diet, whatever calcium you give the person is really of no benefit. You understand? So this nutrition supplement has really been debunked. This is the situation. It has been debunked. But treatment, yes. If we detect it early, based on how we categorize you, we detect it early, we encourage bed rest.
Okay.
When it is necessary, if the BP is that high, we need to give you medication. We will do that as such.
Okay.
When the person comes in an acute emergency state too, we know how to manage. If the person comes with complication and we need to terminate the pregnancy with immediate effect, we'll do that. So it's based on how the person presents.
Okay.
So the key thing to send, or the take-home message is that make sure you detect it early, and then you'll be able to manage it accordingly.
Wow. We have a text from Achupui from Wegbe. He says that sticking fatty foods also contribute to this condition. It's an interesting one.
Yes, but I'm here to read anywhere that fatty food. Of course, taking in fatty food in excess already will worsen your condition if you are predisposed to developing hypertension. If you
Your
take,
family line and all those
yes,
things. Okay.
will worsen your condition. Of course, yeah, I mean there have been theories back and forth that in excess intake of fatty food, excess.
Excess.
We are not saying you
Don't take.
but excess intake of it could contribute to hypertension in general, not necessarily hypertension in pregnancy.
Okay.
Of course, if you are hypertensive and you get pregnant, that's
Yeah,
hypertensive in
in pregnancy
So,
for you.
of course, so yes, the excess of it. Even with regards to the prevention, there have been others talking about reducing salt intake.
Okay.
But
Okay.
the research, yes, has shown it doesn't really help.
Okay.
It doesn't really help. Yes,
I
it
see.
doesn't really help.
So for your pregnant women, would you say moderation in the use of salt is also good?
Every patient is peculiar.
Okay.
Yes.
Okay. So you
What
treat
I may
according.
recommend for this particular patient may not help you.
Okay.
Yes, because for some people, for instance, if you are hypertensive and you are not pregnant, the medications you may be taking will be different from
Those
because
who-
yes, who are pregnant.
Okay.
So if you are a chronic hypertensive patient and you are on a medication, once you get pregnant, you need to see your doctor for
Will
review
change.
of your medication.
Okay.
Because this time it's not only you, but
The
you
baby
and
too.
your baby. So it is important we factor.
So let me ask this. So what if the person the woman is pregnant? Does the child also's BP and everything also go up? Does it affect the child?